Hi guys, ayan, lalabas kami ngayon. May check-up, may heart check-up ako. So, titingnan nila ang aking heart. At sana is lahat is good, di ba? So, ngayon uli ako, ito the echo at saka ECG ata. Ngayon, so, ayan, pupunta kami, babiyahe kami ng maaga kasi medyo malayo siya dito sa amin. Yung hospital ko is SINAI mamaya, nakalimutan ko eh. Mahirap siyang bigkasin sa totoo lang. So, nagising ako ng kay aga-aga ngayon para mag-ayos. Tapos, i-drop din namin yung aso sa, sa daycare ng mga aso. So, maglaro muna siya dun. Iwanan muna namin siya dun. So, meron siya ngayong, play, days. Araw na to, araw ng paglalaro ni Jasmine. So, makakilala siya ng iba't ibang aso dun, iba't ibang hayop kagaya niya. O, diba? So, may magbabantay sa kanya dun kasi ewan ko kung kakayanin nila. So, hopefully, kakayanin nila. Kasi, para pag umaalis kami, naiiwanan namin siya dun. Sa panahon kasi na to, sobrang hyper pa niya kasi baby pa lang siya eh. So, mamaya guys, samahan nyo ako sa aking check up. So, ayan, handa na si Jasmine kasi lalabas na siya guys. Pupunta siya sa kanyang daycare. Ayan, meron siyang bag. Ito yung bag ni Jasmine. O, diba? Bonggang-bongga si Jasmine. So, lalabas siya ngayon. Right, Jasmine? Where are you going? Huh? Are you excited? So, excited siyang lumabas, guys. Kaya, ayan. Ayan, tingnan mo, nakaupo pa ang buwang, oh. Talagang, napaka-behave niya ngayon kasi lalabas siya, eh. Tingnan mo si Jasmine, oh. Halika, come here. Come here. So, excited siya, guys. Napaka-excited ng hayop. Sit first. Sit. 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 Okay. Okay, ayan na. Nalabas na kami, guys. So, itong car kong gagamitin na. So, ayan guys, i-drop namin si Jasmine sa PetSmart. Ayan, pupunta si Jasmine doon kasi gusto niyang maglaro. So, ayun, may dala siyang bag. Tapos may dala din siyang food. So, sana mag-enjoy siya. Eto guys, dito namin iwanan si Jasmine. Ayan na siya guys, lalabas na sila PetSmart. So, dyan siya pupunta. Iwanan muna namin siya dyan.
Head southwest.
Yan, dyan guys. Yan. Nag-aantay ako guys sa aking husband kasi hinatid muna niya si Jasmine dun sa sa PetSmart. So kasi maglalaro nga yung bata. So ayan, nag-hyper. Diyos ko, sana magustuhan nila yung aso. O baka ayaw nila.
Diyos ko, parang ang tagal ng asawa kong lumabas. Baka mamaya ibalik pa yung aso. Pupunta pa man din kaming hospital. Ayan wala, di pa talaga lumabas yung aso. Ay, yung aso yung asawa ko. Tagal na lumabas. Baka Diyos ko, sana okay lahat. Wala kami mapag-iwanan sa aso namin guys. Ito lang talaga yung yung sa dog center, dog daycare. Sana maging okay. Hyper kasi yung aso, hindi namin piniiwanan sa bahay. Diyos ko, kabado ako. Ano ba yun? Ba't ang tagal naman? Yung check up ko pa naman, kailangan nandito kami bago mag-10. Although yung check up ko is 10:30 pero malayo kasi. Nasa kasi yun sa Los Angeles, sa Hollywood. Hello, uy. Oh my God. Guys, sa wakas, okay na si Jasmine doon. So, aalis na kami, papunta na kami ng aking check-up. Ayan. Samahan niyo ko. So, ayan guys, parang ang init ngayon. Ito yung downtown Los Angeles, guys. Ayan. Nasa downtown Los Angeles kami ngayon na. Ayan yung downtown Los Angeles. So, Mausok ba? Mausok pala. Parang nga mausok. Ayan. Oh, parang may sunog talaga. Nagaganap. Tingnan nyo guys, oh. Parang may sunog nagaganap kasi ang fog. Ah, fog. Usok. Mausok. Ayan. Hala, ang usok. Mainit ngayon pero sobrang usok. So meron nga talagang ano. Merong nagaganap dito sa ano. Na malapit-lapit lang din dito or naapektuhan yung ano ng downtown ano, Los Angeles area. So,
Hold. I think so ito na yung ano ko guys, hospital ko. SINAI. CEDARS SINAI Hospital. So ayan guys, paano na kami ng aming nasa ano na kami, papuntang parking lot. So CEDAR pala yun, CEDARS SINAI. Ayan guys, ang aking hospital. Ay, so, ayun na guys. Waiting kami guys. Waiting. Okay, ayun guys. Papasok na kami. Yeah. So, dito na kami guys. So, ayun guys. Nandito na kami. Punta kami sa reception. Ayan.
Is that your stuff?
Yeah, that's it.
Correct?
Yes.
Allergies, right?
Yes. Okay, we're good. Accept. Yun ang aking paperwork.
Sign with your finger.
Oh, diba, bongga?
Sign it.
High-tech. High-tech, guys. High-tech na tayo ngayon. Oh, high-tech, diba? Gusto ko to. Sign in again? Oh my God. Oh, is that front? So, waiting kami guys. Ayan. Yan yung down. Ayan. Ito yung area kung saan ako guys na hospital. Saan ako inoperahan. Ayan. 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 So, ayun guys. Nakaganito na ako guys. Antay na lang akong kuhanin dito. So, start na ako guys. Magbihis na ako. Tingnan nyo guys, kasi yung doctor ko is a baby. Para sa mga baby. So, yung room ko, parang ano din, yung room ng ano, is parang pang baby din. Ayan. So, ayan guys, nag-aantay lang ako ng aking doktor, si Dr. Pumpkin. So, inaantay dito muna ako, nag-antay ako sa kanya. Yan. Dito ulit ako, guys. Antay-antay ako kay doktor.
So as you know, your PDA or your patent ductus arteriosus was a connection here between these two blood vessels. This is your aorta and this is your pulmonary artery. So this goes out to the body, this goes out to the lungs. All babies are born with that connection, and usually by the first few days of life, it regresses, okay? It goes away and just becomes what's called a ligamentum, so just some connective tissue. In your case, it stayed as an open vessel or an open pathway. So you could actually have blood flow between these two vessels, all right? And what was happening is that preferentially you had blood that was coming from the pulmonary artery and going into the, blood from the aorta going into the pulmonary artery. So red blood coming over into the blue blood, okay? What that was doing, so all of this blood then goes out to the lungs and then returns to the left side of the heart, okay? This is the side that pumps then out to the body. With your shunt, having that open, it caused the left heart over time to get enlarged because it was just seeing extra blood volume with every heartbeat. So Dr. Zahn went in with his coil and coiled that connection, that vessel. So it's completely gone, okay? So you no longer have a connection now between these two vessels. As a consequence of that, as we talked about last time, the left heart has remodeled back to a normal size. Okay, so it's no longer seeing that extra volume that you had for your whole life before the closure. So that's now all gone back to a normal size. In addition, when we have that extra blood flow that's going out to the lungs, sometimes the pressures in the lungs can be a little elevated, and yours was mildly elevated at the time of the procedure. All of that looks like that's normalized as well. Okay, so I think we caught this at a really good time, and I expect you to do really well from that perspective, okay? In addition to the PDA, one of the things that we diagnosed you with was high blood pressure. And it doesn't seem to be related to your PDA. I actually think it's two separate issues for you. And as you know, we did the CAT scan, we did blood tests, we did all these things to make sure there wasn't something that was driving your blood pressure other than just maybe a genetic predisposition because you're young and healthy, otherwise. But that kind of very thorough evaluation was negative. So we didn't find anything that we could sort of correct that was driving the high blood pressure. Really just seems to be, I suspect, a genetic predisposition. Something within your family, or just kind of audiogram that the walls of the left ventricle are a little bit thickened above normal. Okay, they're mildly thickened, and that the aorta here, that's the vessel that comes off of the left heart, is a little bit dilated, so it's a little enlarged. Okay, that in combination with high blood pressure means that we need to just treat the high blood pressure. Because high blood pressure. So when you have the high blood pressure, it can cause the thickening of the heart muscle there, and it can cause further dilation of the aorta. So this is why, because you're so young and we can potentially have years of high blood pressure, it really needed to be treated, because the consequences of not is that thickening of the heart muscle can get worse over time and eventually cause heart failure when you're an older person. And then we don't like that aorta to get too dilated or enlarged because it could potentially tear. And that could be life-threatening. Yes. You're very far away from any of those worst-case scenarios, okay? But the point is
my
that
blood pressure.
Yeah, this is why we want to get it under control now when you are so young, because we don't want all of those things to happen in your 60s, 70s, 80s, right? So this is why we're aggressive and have you on the lisinopril now to get that under control. Okay, so you always have what we call white coat hypertension. So meaning that when you come into the clinic office,
it's like
your blood pressure is a little bit
it's
high.
like higher.
And then that's why we did the ambulatory blood pressure monitor on you, remember? And so when you go home on the lisinopril, your pressures come down to a really nice normal range. Okay. And then I think that these numbers in the low 130s when you come into the office, it's just consistent with a little anxiety of being here. Okay, so I think the lisinopril 5 milligrams is a good dose for you, because we showed that you were very well controlled when you went home. So, and I don't think we need to change it today, because you're
we're good.
You're good. I
good.
I think everything looks stable from last visit. So I think we should just continue the medicine. Reassuringly, the thickness of the wall muscle looks stable on your echo today. It doesn't look thicker. Okay?
That's really good.
The size of the aorta is stable too. It doesn't look bigger. Okay, so I think everything is unchanged and
yes,
stable.
like being normal, not like before, like there. So guys, we're done. We're done everything, and I'm still fresh. I think. Oh, here, babe. So, uwi na kami guys kasi gutom na ako guys. Gutom tunggots na ako, tunggot. So, ayan guys, mag-CR lang ako after this. So, pauwi na kami guys kasi gutom na ako. Antay lang kami ng aming sasakyan. Ayan.
So, ayan guys, itong araw na to, tinanggalan ako ng ilang botelyang dugo. Ayan, tinanggalan ako ng 1 cc na blood para sa aking blood works. So, sabi ng aking doktor, tatawagan lang din nila ako pagka makita na ang result. Kasi nga daw, para make sure na ang aking blood sugar, wala akong problema sa aking blood sugar. So, I'm not a diabetic, ha? Hopefully. So, I don't know. So, yun, tinatry nila akong i-check yung mga yung mga small and large intestine. And then, sabi ng aking doctor is all is good. So, ang aking heart condition is good. And except my blood pressure is high. So, need ko siyang i-work out. And then, sabi ng aking doctor, need ko din mag-exercise every day. Just for walk or something, activities. And then, sabi din niya, don't be stressed. Sleep good. Eat well. And eat some fruit and vegetables. So, make sure that I have long lives. So, siguro kailangan kong kumain ng pansit kasi pansit is long lives. For long lives, ha? Ng pansit. So, yun, ang magandang
Eating so much salt, that's your problem.
Yeah,
Salty food.
I love salt. So, yun nga guys, yung sinasabi ng aking doctors. At sabi niya healthy daw ako. Lahat is okay, except my blood pressure. So, siguro need ko nang mag-less ng salt. Kaya sana lahat is magiging okay na lahat. So, thanks God for my second life, for everything. And for more years to come in my life. Ayan. So, for 1,000 years. 1,000 years? Oh my God.
Years confused with hours.
Yeah. What? So, pauwi na kami ng aming bahay. We're going home. Pick upin namin ang aming doggy. Hopefully, nasa siya, good mood siya ngayon at hindi na siya hyper. Sana nga. So, ayan guys. Sana is nasa maganda tayong kalagayan lahat na yun guys. God is good. God is good all the time. Kaya, ingat man tayo kung saan man tayong sulok ng mundo ngayon guys. Ayan. Big love shoutout everyone. And to my team. And to my Chamber of Success member. Thank you so much everyone. At sa lahat ng mga supporters. Ayan, alam niyo na kung sino kayong lahat dyan na nagmamahal sa akin. Thank you so much and God bless everyone. Bye! Say bye, babe. Bye!
So, ayan na guys, kinuha namin yung aso. Inaantay ko lang lalabas sila. Ayan. Nagko-hotel yung aso namin. So, ito kakarating lang din namin dito from the hospital. So, pick upin na namin ang aming doggy. But little bit, tagal nila.
It's amazing. It's 95.5 kilowatts.
Ano pa man kami kasi merong magano ngayon doon ng may mag-deliver ng cellphone ngayon sa bahay kasi yung cellphone ng asawa ko i-deliver. So, parang tagal nila. Baka nasa bahay na yung nag-deliver. Diyos ko.